let me know when you're on the YouTube. Okay. There is a bit of a delay talking into the microphone. Mic check, 1 2 1 2. 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 You hearing it? Mic check, 1 2 1 2. Oh, we're good. Okay. And then, just real quick. And testing the secondary microphone, testing the secondary microphone, testing the secondary microphone, testing the secondary microphone. There's a long delay, yeah. Testing secondary microphone, testing the secondary microphone. Okay.
Good afternoon and welcome to today's briefing. With all that's going on, I appreciate that you're here to cover COVID. We're grateful for your help providing accurate information to residents about how to reduce risk while transmission remains elevated. Today, I'll go over the most recent data and how the current transmission levels are reflected in our early alert metrics and the healthcare system. Dr. Andrea Kim is also joining me today, and she'll give a brief update on Mpox, formerly referred to as monkeypox. Next slide. Each week, I start with the updated trend lines for COVID-19. On this graph, you can see trend lines dating back to April of this year. The green trend line shows the 7-day average of the number of cases reported daily and is measured using the vertical axis on the left. As you can see, we have experienced a welcome decrease these past few days in case numbers, with an average of over 2,600 cases reported per day. This is a 12% decrease from the 7-day average of nearly 3,000 cases reported per day last week. Despite the decline, transmission does remain elevated, with current cases more than 42% higher than 1 month ago. The number of reported cases provides some good insights about transmission levels, especially when we're seeing large increases or decreases. However, as we all know, this metric doesn't catch all cases, or most likely even the majority. In addition to reported cases, there are positive cases in the community from people who test at home, people who don't test, and people who may have few or no symptoms. Regardless of whether a case is reported or not, increased transmission in the community can lead to increased hospitalizations and, sadly, deaths. The orange trend line shows the 7-day average hospital admissions. This past week, there was an average of 178 admissions per day, a small decrease of about, 10% from 1 week ago. Therapeutics and the bivalent booster both play a role in decreasing severe illness, and I'm thankful that we have residents taking advantage of these options. While the decrease is positive news, as you can see on this graph, admission numbers are still higher than they have been since April, and they're above the peak number of average hospital admissions during the summer surge, which peaked, as you can see, in mid-July. The blue line on this slide shows the 7-day average number of deaths reported daily, and it's measured by the axis on the right. We're currently reporting an average of 21 deaths per day. This is a troubling increase from the average of 16 deaths reported per day last week, and especially concerning when you realize that this number is more than 2.5 times higher than reported deaths at the beginning of the month. 74% of deaths in December were individuals 70 and older, which means that about a quarter of the deaths were for people younger than 70. I offer my condolences to all those who have lost someone to COVID-19 during these past few years. I know this is a especially difficult time of year to be without a loved one, and I'd like to extend my deepest sympathies. Next slide. For hospitals, this fall and early winter has presented challenges of caring for individuals with illness associated with RSV, influenza, and COVID. On this graph, we see the number of reported available hospital beds for adults from January through December, beginning in 2019 and going through 2022. The red line at the bottom is 2022, and it shows where we are now. The blue line is pre-pandemic 2019, the yellow is 2020, and the green line is 2021. The large spike in bed availability during the spring of 2020 is because many hospitals set up extra beds to cope with the surge, and elective procedures were canceled, adding to the available bed count. This data is collected from 90 hospitals that are polled daily by the LA County Emergency Medical Services Agency. An available bed refers to beds that are unoccupied and to which a patient could be immediately transferred to, where there would be the necessary space, equipment, and staff available to support the patient. The counts shown on this graph represent monthly averages. The average number of available beds so far this December is 210. This is the lowest we've seen, as you can see, in the past 4 years. The number of available hospital beds is affected both by increased patient need and staff availability. With high rates of respiratory virus illness, many staff are getting sick themselves and or caring for sick family members, further diminishing the bed supply. While hospitals in LA County currently retain full capacity to care for all those in need, and we encourage everyone to seek care if they experience any severe symptoms of illness, including difficulty breathing, severe chest pain, disorientation, or trouble staying awake, it is important to acknowledge how easily the hospitals can become stressed. Next slide. On this slide, we have graphed the same hospital bed availability data for pediatric beds. This includes the pediatric ward and the pediatric intensive care unit beds. And as of December 19th, there was an average of 69 available pediatric beds across reporting hospitals. This is up slightly from 59 in November. As with adult beds, this is some of the lowest availability that's been seen in the past 4 years. It's important to note that in LA County, as it is across the country, there are far fewer pediatric beds available in general than adult beds, because children require hospital care at much lower rates than adults. However, as we did see this past month, young children can be susceptible to severe illness from respiratory viruses, including RSV and flu. And when levels are as high as they are now, pediatric hospital bed availability can drop rapidly. So everyone's encouraged to take steps to curb transmission of respiratory viruses, including masking in indoor public spaces and staying home when you're sick. Next slide. As we noted earlier, severe illness associated with COVID disproportionately affected older residents. Here we can show the 14-day cumulative hospitalization rates by age from March 1st through December 19th of 2022. 6 age groups are on this slide. The green line represents people ages 0 to 17. The purple line represents ages 18 through 29. Ages 30 to 49 are shown by the blue line. The yellow line are ages 50 to 69. Ages 70 to 79 is the orange line. And the red line tracks hospitalization rates for people 80 years and older. As of December 19th, we're seeing significant hospitalizations across all age groups. and with the exception of 18 to 29-year-olds, hospitalization rates for all groups have doubled since November 19th, 1 month ago. Even in the 18 to 29 age group, the hospitalization rate still increased by about 40%. Striking on this graph is the fact that hospitalization rates are higher now than they were during the summer surge, reminding us that COVID-19 has not evolved into a benign virus. Hospitalization rates for those over 80 are currently nearly 50% higher than they were during the peak of the summer surge in mid-July. And this is true for everyone 30 and older. While we're not able to fully understand the exact cause of the higher hospitalization rates, we are certain that reducing transmission reduces risk for those most vulnerable, while also preventing additional stress on healthcare providers and hospitals. Next slide. Although transmission remains elevated and hospitalization rates are higher now than they were in July, as we noted earlier, our case numbers are declining. And with the decline in the case rate, LA County will move today from the high community level to the medium community level. Today's case rate is 180 new cases per 100,000 people. The CDC designates a county as being in the medium community level when their case rate is fewer than 200 and new COVID-19 admissions are below 20 per 100,000 people, and the proportion of inpatient beds occupied by COVID-19 patients is less than 15%. As you can see on this slide, our hospital metrics remain stable, with the rate of new COVID admissions as 13.6, and the percentage of beds occupied by COVID patients remains at just over 7%. So while our hospital metrics haven't declined appreciably since earlier this month and last week, with the changes in the threshold levels associated with the county's case rate, CDC reduces the risk assessment level to the hospital system, and now we're in the upper half of this table. If the case rate, however, increases even a little bit, we would again be moved to high, assuming our hospital numbers hold steady. COVID-19 community levels help convey how much impact COVID is having on a community and the hospital system based on the most recent data. It is possible that LA County will continue to move back and forth between medium and high for the next few weeks as these levels are tied closely to the case rates. Given that upcoming holiday gatherings and travel could lead to increased transmission, we continue to urge residents to layer in protections over the next few weeks. I've been seeing a lot more people masking indoors, and I know that more people are getting vaccinated with the bivalent booster. We're now over 19% of eligible residents boosted. That's up from, I think it was just about 15% not even a month ago. These steps are likely to contribute to lowering our case rate, and we can take moving into medium as a sign that these efforts to reduce COVID-19 are helping. I encourage all of us to continue these steps during the holidays, since the risk does remain elevated. Next slide. To better understand potential changes in COVID transmission and the direction we're heading, Public Health does monitor our 8 early alert signals. This week, the only major change we have seen across indicators is the number of new outbreaks in TK through grade 12 classrooms in the past 7 days moved from high concern to low concern, and this is because most schools have dismissed students for the winter break. The percentage of specimens identified as new subvariants and sublineages of interest, the SARS-CoV-2 wastewater concentration, and the number of new outbreaks in skilled nursing facilities over the past 7 days remain high concern. And while emergency department visits for COVID remain of medium concern, there were some small increases these past couple of weeks, moving this metric closer to the threshold of high concern. Next slide. We do continue also to use our wastewater monitoring as a valuable tool to better understand the extent of community transmission, especially when we know that reported cases are an undercount. This graph displays our wastewater viral concentrations of SARS-CoV-2. The blue line is a weighted average for viral concentration across 4 wastewater treatment plants, weighted by the population served by each plant. For the most recent week, the viral concentration is at 89% of the peak concentration seen in July during our summer surge, keeping us in the high concern category. Last week, per our earlier alert metrics, we did surpass that summer peak. The drop in SARS-CoV-2 wastewater concentrations that we see this week does correlate with the decrease in reported cases that we showed you on the trend lines at the beginning. But we're not certain whether this downward trend will continue as we face the very real possibility that transmission will increase again after the holiday. Next slide. We can also take a quick look at what we're seeing with wastewater concentrations for flu and RSV. This slide is the weighted average wastewater concentrations of influenza A. You can see that in early October, wastewater concentrations began to rise, corresponding with what we consider the beginning of flu season. And the concentrations really increased with a steep upward trajectory until about the week that ended December 10th, when we started to see a very small decrease in wastewater concentrations for flu. This decrease is also in alignment with what we're seeing from our LA County labs, which are starting to report declines in the percent positivity for flu. And this is also good news. But it is important to remember that here in LA County, we're seeing very high levels of flu activity for this time of year. Compared to 6 previous flu seasons, beginning with the 2016-17 season, the proportion of specimens that are currently testing positive for flu remains higher than the peaks observed in 4 of the 6 seasons. And it's still early in the flu season, and we're likely to continue to see high levels of flu activity for at least a couple of months to come. I do want to remind people that the seasonal flu vaccine remains a very good match for what's currently circulating, and it will provide important protection. Next slide. I also want to share the wastewater data for RSV. While the percentage of respiratory specimens at LA County Sentinel surveillance labs testing positive for RSV has significantly decreased, the RSV detected in wastewater has not. And after a small dip, we're now seeing increased concentration levels. As with our flu wastewater data, this is the weighted average of RSV concentrations across the Water Pollution Control Plant, the Hyperion Plant, and the Lancaster Sewer Shed. Indicated by the blue line, the concentration of RSV in wastewater is now at the highest point we've seen this entire season. Now, RSV is more severe in children, and therefore they're much more likely to be tested. The increase shown in this graph is very likely the result of more adults having more mild cases of RSV, which means that the virus will still show up and shed in our wastewater. But we may not be capturing these milder infections with the Sentinel lab reports. Overall, the wastewater data highlights that RSV activity is still high, and steps to prevent transmission remain important, especially as we noted, we have flu and COVID continuing to be in high transmission as well. Next slide. Throughout the pandemic, we've seen how new variants and sublineages can drive surges, evade prior immunity, and cause the need to update protections, such as therapeutics and masks. Because of this, we continue to monitor changes in the prevalence of multiple COVID-19 strains. In LA County, BQ.1 and BQ.1.1, that's represented by the light pink and purple bars at the top of the graph, continue to be the dominant strains, cumulatively accounting for nearly 60% of our sequenced specimens. The previously dominant strain, BA.5, that's the red bar, is now just over 20%. At the top of the graph, in the yellow bar, we're tracking XBB, a recombinant strain of 2 BA2 sublineages. In November, we saw the percentage of sequenced specimens that were XBB increase from about 3% to 5% in the course of just 1 week. But however, as you could see, the increase recently is much more modest. And for the most recent week, XBB accounts for 6% of specimens. This is like a tiny increase from the 5.8% we saw the week before. The CDC does calculate predictions of the estimated proportion of each COVID strain circulating now, since we all have a 2 to 3 week lag in lab data due to the time it takes to sequence specimens. For Region 9, which includes California, the CDC predicts that XBB now accounts for about 8% of specimens, while BQ.1 and BQ.1.1 cumulatively account for nearly 70%. As a reminder, these new COVID-19 strains often result in more potential for easier infections. We continue to monitor the changes, especially since we know that the impact is often going to be felt amongst people who may be more vulnerable. Next slide. I do want to close the update on respiratory viruses by asking everyone to continue to take wise actions that protect those most vulnerable in your family, at your jobs, and in the community. It can be a tough task for those with advanced age or who are immunocompromised or who have underlying health conditions to go it alone. The spirit of the holidays allows us to reflect on the joys of being together. So as we gather over the next couple of weeks, please continue to take precautions like washing hands often, increasing ventilation, and maximizing protections against severe illness. If needed, you can drop into a pharmacy today and get your updated COVID-19 booster and seasonal flu shot, as well as hundreds of community sites across the county. Both of these vaccines will begin to provide some protection immediately, helping to protect yourself and the people around you. I'm happy to report that the number of people receiving the bivalent booster does continue to rise, and I encourage others to go ahead and take your opportunity now to add in those protections. You can find a vaccine location, or if you have questions, you can visit us at ph.lacounty.gov/how-to-get-vaccinated. It also continues to be very important to mask in indoor public spaces, wearing a high-quality mask that fits well. Reduce transmission risks, especially from those who may be infected and still without symptoms, by testing before gatherings, events, or visiting with someone who is at higher risk for severe illness from COVID-19. Insurance plans are required to reimburse for the cost of rapid at-home tests, and these are easy to have on hand. More information on the types of tests, where to get tests, and how to interpret tests is available at ph.lacounty.gov/COVID tests. You can also now order free at-home tests, 4 per household, from covidtests.gov. Lastly, stay home if you're sick or if you have symptoms at all. Viruses cause a ripple effect as they move from one person to another, and infection can easily reach those we hope to protect. While alone, vaccination, masking, testing, and staying home while sick are all good practice, layering these protections provides a big bonus as each play a role in preventing illness. If you have questions about the vaccine, symptoms, way to help a loved one who's been exposed, way to get your therapeutics if you've tested positive, or any other needs related to COVID-19, the Public Health Call Center, 540-0473. With that, I'd like to introduce Dr. Andrea Kim, the Director of Vaccine Preventable Disease Control, who will provide an update on Mpox and on updated vaccine eligibility.
Thank you, Dr. Ferrer, and good afternoon. I'll be providing a very brief update on Mpox, starting with the case trends we are seeing in LA County as we continue to monitor the outbreak. There has been a total of 2,264 Mpox cases reported in Los Angeles County, 126 reported in the city of Long Beach, and 30 reported in the city of Pasadena, for a total of 2,420 cases countywide. As of December 10th, the 7-day average for Mpox cases was less than 1 per day, and I'm very happy to share we are now seeing some days without any reported cases at all. It is important that we continue to monitor the outbreak and take measures to prevent another surge, including sharing information and access to vaccines for those who are at risk for contracting Mpox. Next slide. So over 74,000 people in Los Angeles County have received at least 1 dose of the Jynneos vaccine for the prevention of Mpox. 2 doses are recommended for maximum protection, and more than half of people who started the 2-dose series have received their 2nd dose. Now in Los Angeles County, eligibility criteria for vaccination has been removed, and anyone who requests vaccination can receive it without having to disclose any information on personal risk. This is a change in policy which will allow more people to be able to access the vaccine without questions asked. The following groups remain at risk for Mpox and are especially encouraged to get vaccinated to protect against infection and severe disease. Any man or transgender person who has sex with men or transgender persons, persons of any gender or sexual orientation who engage in commercial and or transactional sex or have sex in association with a large public event. Persons living with HIV, especially persons with uncontrolled or advanced HIV disease. Persons who had skin-to-skin or intimate contact with someone with suspected or confirmed Mpox, including those who have not yet been confirmed by public health. Sexual partners of people in any of the above groups I've mentioned. Most people with Mpox have mild to moderate illness and hospitalization rates have remained low. However, those who are severely immunocompromised are at risk for serious illness and death and should be vaccinated. Residents seeking the vaccine can get it from their healthcare provider or a public vaccinating site, or they can visit myturn.ca.gov to find other vaccinating sites near them. If residents think they have Mpox, they should speak with a provider and get tested. If residents do not have a provider, they can call the public health call center for more information on Mpox, including general information, testing, treatment, and vaccines. And the number is 833-540-0473. It's open 7 days a week from 8 a.m. to 8:30 p.m. For more information about Mpox symptoms, where to get vaccinated, or where to find additional resources, you can visit our website at http://publichealth.lacounty.gov/monkeypox. Thank you for your time today, and I will now hand the floor back over to Dr. Freire.
Thank you so much, Dr. Kim. In closing, 2022 brought new challenges in dealing with COVID-19, while also a lot of optimism with the advancements such as the bivalent booster and wider access to therapeutics. I want to thank all the people in LA County who play a role in keeping us safe and keeping us going, including healthcare and essential workers. I also want to say a thank you to the media partners that have been with us throughout the last almost 3 years. Your help allows us to reach as many people as possible, which in turn makes for a safer and healthier LA County. We wish you and your families every opportunity to have a joyous holiday season. Dr. Kim and I can now take your questions.
All right, the first question is from Emily Valdez at KNX. Dr. Freire, she was hoping you can go over COVID deaths again and pull up the slide relating to that, if possible.
Okay, we have to go back. I think that might be the third slide, or the second slide. Is that something you can do, or I don't see it on there.
Oh, on the screen.
Yeah, so I don't know if that means it's, I can bring mine and just.
Here we go.
Right there.
Okay.
Yeah, I mean, you know, with every increase in cases for the last almost 3 years, a few weeks later, we've always seen a corresponding increase in death. It's tragic, but we know that when there's more transmission, more people end up being hospitalized, and sadly, some of the people with severe illness don't make it. One thing I want to note is that although we are surprised to see this big of an increase in this particular surge, if we were to look at this over the longer period of time, we would all recognize what great advances we've made, because we've dramatically reduced the number of people who do die from COVID. Sadly, it's just too high for us to go ahead and really negate the increased mortality that remains associated with getting infected with COVID for some people in our communities who are more vulnerable.
Thank you. The next 3 questions are from Luke Money with the LA Times.
Let's take them one at a time.
Okay. Question 1. Given the low vaccination rate among children under the age of 5, what sort of demand do you anticipate for the bivalent boosters among this age group? Are you concerned at all with the low level of vaccine coverage among those young children?
Yeah, thanks so much, Luke. And of course, we're always concerned with lower vaccination rates amongst children. In particular, because as we've seen, some children will still get severe illness. And tragically, in LA County, 20 children have died. So from COVID. And, this is compounded now. I want to talk about vaccines in general because we have a vaccine for flu as well. And we'd like to encourage more children to get vaccinated for flu. That vaccine is eligible for, everyone is eligible 6 months and older. And so I do urge parents, talk with their medical care provider, their child's pediatrician or care provider, and reach out to us if you have questions about vaccine effectiveness. We have seen that these vaccines are very safe and very effective. I think it's our job as public health practitioners to continue to engage in conversations with people in the community and make sure that they have good information so that they can make the best decision for themselves and their children and their community.
His second question, does the county have an estimate as to how many people have gotten their flu shot this year?
And that's a very hard number for us to get because there's no tracking. Well, unlike COVID, where we track so many variables, including, our case numbers, we have some wastewater data that we can look at, and we track every single vaccine dose that's administered. There is no such database that we can look at to know exactly who's been vaccinated from flu. But ask Dr. Kim if she has any, these are all estimates about where we are in LA County. I mean, we also can see some estimates for the national, for our entire country. But feel free to come.
Thank you, Dr. Freer. Yes, one of the limitations here in LA County is that reporting vaccination is not mandatory for providers. So because of that, we do have a registry, but it's not complete. It's an underestimate, but luckily we do get access to that data, and we are starting to look at what does that look like for this flu season and how is it comparing to other seasons, just to look at the trends rather than the levels. So far, it looks like our vaccinations are around similar to what we have seen last year, and also higher among our seniors, which is great. So higher among our seniors from what we've seen in the past years. It's all an estimate, but in general, I think about close to 2.5 million in the registry, but it's going to be a lot higher than that because not all providers are reporting. Thank you.
And his last question, does the county have any data as to how many residents have received the Novavax vaccine?
We can actually get that data to you, Luke, so we'll make sure that somebody follows up. I don't have it off the top of my head, but yes, we track by the vaccine type, so we'd be able to get that information to you.
Okay, that was our last question, Dr. Freer. Thank you.
Thank you. Thanks, everyone, and we wish you a very happy holiday.